Welcome back, folks, to clinicalhandout.com. This is Dr. Dean. I'm medical oncologist, board certified hematologist, and we're going to be reviewing the chemotherapy regimen known as FOLFOX. Here at clinicalhandout.com, we are creating clinical handouts that can benefit patients so that they can bridge the gap between their provider and themselves to empower them in their care. Now, we're creating this educational series to complement our handout, so you have a hard copy as well as educational visits and information to help you when you do see your doctor or oncologist. So the chemotherapy regimen that we're going to be talking about is FOLFOX. And this regimen, which we're going to break down into the 3 drugs that are contained within it, is commonly used in the treatment of colon cancer. So the types of indications when you use it for colon cancer is in the advanced setting or stage 4 setting. That means that the cancer is often not curable. Sometimes there are some ways and possibilities that it could be cured if there is only small disease burden in the lungs or in the liver. There may be some opportunity for curative intent, but that's going to be a discussion with the patient and their oncologist and their surgeons. However, often it's used in the stage 4 setting as a first-line chemotherapy regimen. It can also be used in the stage 2 setting as well as stage 3 setting in the adjuvant setting. So that means that somebody has undergone surgery, the tumor is out, the lymph nodes are out, everything's been dissected, and then when the specimen goes to the path lab, they review it and they may see some high-risk features. And if there are some high-risk features, which we can potentially discuss in another video, then your oncologist may recommend using this chemotherapy regimen. Now, you might use this chemotherapy regimen in order to squelch any residual cancer cells that might still remain. And overall, it's showed that it can improve outcomes in these patients. So the first drug in the regimen is known as folinic acid. The next drug that stands for the F is 5-FU, also known as fluorouracil. And then 3 is going to be oxaliplatin. Now, these 3 drugs work in synergy, meaning they work together. In particular, the folinic acid amplifies the 5-FU. It's known as a folate derivative. So it amplifies the effects of 5-FU, and it's given in conjunction with 5-FU. Now, the oxaliplatin is a platinum-based chemotherapy, and this disrupts the DNA replication cycle. 5-FU also does that. It's known as an anti-metabolite. So these are the chemotherapies. They disrupt DNA synthesis pathways in the cancer cells. When you disrupt DNA, you're disrupting the blueprint and the instructions for the cancer cells to make more copies of themselves. And we know that cancer cells divide rapidly and they turn over often, and so we use that to our advantage by introducing chemotherapy. Yes, often people say, "Oh, it's a poison." It's a poison more so to the cancer cells than it is to normal cells. And so we can eliminate cancer cells by disrupting the DNA pathways. So there's really no side effects with the folinic acid. As I mentioned, it's a folate analog. The 5-FU can actually be can have some side effects. The most common side effects that we see would be nausea, vomiting, diarrhea. Mucositis is a possibility. So we're going to say mucositis, which means some mouth sores. We said nausea, diarrhea is a possibility, and then fatigue. Now, we don't have great treatments for fatigue. However, taking it easy when you're on this chemotherapy is important. There are some drugs that sometimes can be given for fatigue, but not often. Sometimes you have to muscle through that. With regards to the mucositis, there can be some oral medications, some topicals that can be used to help reduce the inflammation in the mouth. Nausea can be controlled through anti-nausea medications, also known as antiemetics, and then diarrhea can be controlled through anti-diarrheal medications. So these are pretty well controlled, I would say. The fatigue is variable from person to person. And then the mucositis doesn't happen all the time. Actually, in most cases, you won't find it. But if it does, you would obviously want to talk to your doctor about ways to manage that. Now, the oxaliplatin, the most common side effect with this drug is a peripheral neuropathy. So peripheral neuropathy means tingling sensation in the hands and feet. And this is a cumulative effect. So This symptom may actually get worse over time. You may not experience it in the beginning, but over time, after getting several rounds of chemotherapy, that peripheral neuropathy may increase. Also, another side effect would be cold sensitivity. And that will be a sensation of when you have ice cream or ice chips that it just doesn't feel right. It feels like a tingling sensation. You don't want to have those foods. And so that's something that will happen, especially following the treatment. You can experience the cold sensitivities. Fatigue is a common issue with oxaliplatin as well, and then nausea. But we can control nausea and diarrhea by using different supportive medications. So the big one that you're going to want to follow for is this peripheral neuropathy when it comes to oxaliplatin. Otherwise, these chemotherapies are generally well tolerated. One of the things with chemotherapy is that all of them can typically cause what's known as immunosuppression. And so you have to be mindful of that the immune system is weakened when on chemotherapy, and it's important to follow closely with your oncologist to monitor your blood levels to make sure that your white blood cell count does not get too low. So those are the main side effects associated with this chemotherapy regimen. Now, the next question is, how is it administered and how often? Now, typically this regimen here is given on a 2-week basis. Now, all 3 drugs would be given on day 1. However, one drug in particular, this 5-FU, is given over 48 hours. And so that means patients will wear a pump or a ball, and that is an elastomeric pump, and it's connected to the central line or port, and the pump uses body heat to control the flow rate of the medication. So we get the best benefit from this 5-FU when it's infused over a 48-hour period. That would mean that if a patient came in on a Monday, they received their treatment, they would get all 3 drugs, oxaliplatin, leucovorin infusions, as well as the 5-FU. It could be a bolus dose of 5-FU, and then the pump is connected. And then the patient would continue to receive their treatment via the pump, and then the pump is disconnected and removed on Wednesday in the afternoon or evening. That would be approximately 46 to 48 hours after it was started. So this is a very common regimen and treatment cycle that you would see for colon cancer. Those are the most common side effects. Please leave your comments, subscribe to our channel, and check out our website for more information. We'll be continuing our education series with different chemotherapy regimens, side effects, and going over the nuances of individual drugs. Thanks so much for watching, and have a wonderful day.